Hi, I'm Christian Gitersonke, CEO of Health Insurance Answers. We're a patient advocate firm that helps patients navigate the healthcare system. One of the most important things for patients to keep in mind is that out-of-pocket costs are not just your co-pays and your co-insurance and what deductible you have for your plan, right? It's also what is the cost of that insurance. If you're with an employer group and the employer group fronts part of that cost, in the state of Nevada, it's 50% is the requirement that the employer kicks in, and then the patient has to pay the other 50%. So there's all these different factors that add up, right? You also want to take a look at your own healthcare and your family's healthcare to decide if, look, we have ongoing, or maybe my spouse or myself have ongoing health issues that we're dealing with. That makes it a little bit more challenging, right? Because you're not just paying a premium and there's a just in case as a backup, right? Which is what the insurance is meant to be, is that you don't end up having to front the bill for all of this healthcare cost because it's very expensive. So, taking a look at your own personal healthcare, the status of your healthcare for your family is super important. After you identify that, really understanding what your plan covers. A lot of times we have patients come to us after they've already seen 4 or 5 or 6 providers. They are having an issue, right? And they go to their primary care, and their primary care sends them to a specialist, and the specialist sends them to a diagnostic center to get testing. And diagnostic center says, well, it's inconclusive, we need more testing. So they send you to another specialist. So, in the course of a couple months, you can rack up tens of thousands of dollars in bills. And if you don't know how to navigate your plan, you can have to front that cost, right? That burden ultimately lies on the patient's responsibility. When you're talking about health insurance, the cost in the contract is between you as a patient and the health insurance company. It's not between the doctor and the insurance company. They have a contract, but really that service that's being delivered is between the patient and the insurance carrier. So the insurance carrier has a series of rules, right, and regulations that the patient has to follow in order for them to pay. And so in that situation where you might be bouncing around to different providers, or maybe you need physical therapy or chiropractic care, your plan may not even cover that. So a lot of times patients feel like that burden should fall to the provider, and it's really not the provider's responsibility. They will call and verify your benefits, and you may have benefits and you go to access them. They just courtesy bill your insurance. It's a courtesy. It's not necessarily a full requirement, right? And after that insurance processes, they may send you an EOB and state, well, you went to the wrong provider. You're supposed to go to ABC Therapeutic, right, clinic, and you went to DEF Therapeutic Clinic, and they're not covered under your plan. So at the end of the day, the poor patients end up with these bills that they don't understand really how to take care of. And also, it really is their responsibility. So a lot of times patients come to us after they've already navigated through this system and they've stumbled and fallen, and they end up with these huge bills. And so that's kind of where an advocate comes in to say, okay, let's sort all this nonsense out. Let's sort through all the explanation of benefits the insurance company has processed. Let's talk to the providers on behalf of the patients, because there's so much lingo involved in navigating healthcare that it's really important to know, right, the language of healthcare on top of your understanding your plan, and that's what we do. So one thing that just happened this past year was the federal No Surprise Act, which was passed, which is a requirement on all healthcare providers to disclose upfront to patients what their out-of-pocket cost could be. So that alone helps, somewhat for a patient to understand that I may end up on the hook for $250 for this series of x-rays, right? But on a more micro scale for patients, asking a lot of questions, right? When you schedule an appointment, it's the patient's responsibility to understand that they have an approved visit, okay? So if they're getting referred to like a diagnostic center for testing or labs that they need done that are ordered from their primary care, it's very important to understand, hey, is LabCorp, Quest, any series of labs out there, are they on my plan? So the things that the patients can do is do a little research, okay? Not just take the word of the referring provider that everything's going to be fine, we've set you an appointment, and you're good to go, right? It's important for that patient then to follow up with that referral, ask those questions, even call their insurance company just to verify, I just want to make sure ABC lab that I'm being referred to is covered under my plan, and I will not have an out-of-pocket cost, or what is my out-of-pocket cost? You know, that's an important aspect that they can do. Now, as a patient, if you end up with a bill, okay, and you're not sure, that's where an advocate comes in to review it and say, okay, let's look at your plan policy versus what the healthcare provider billed you, and let's figure out if it's correct. So 70+% of the time, it's not even accurate. I mean, those are national statistics. You can look them up. 7 out of 10 healthcare claims have at least one error on them. And that's not usually in favor of the patient, okay? And there could be coding issues, financial issues, referral issues, prior authorization issues, any number of issues. But that's not good odds, right? That when you go to the doctor, that bill is going to be billed and processed correctly. So as a patient, if you end up with a bill, it's really important to understand. A copay is very simple, right? You pay that before you see the physician. When it gets tricky for patients is if your primary care refers you to a specialist, to an oncologist. And now you're going to a specialist. Well, you may not, most patients do not have the same copay due for a specialist versus their primary care. You may pay $20 to your primary care, you may pay $60 to your specialist. If you're getting treatment, right, or physical therapy, there may be a series of out-of-pocket costs that are associated with that. So it's important. I mean, that's one of the big drivers in why healthcare isn't working is patients are not involved. And you have to be your own advocate, right out of the gate. Ask a lot of questions. If it doesn't make sense or you're being billed a balance bill for a service you had and you don't understand it, you either need to ask those questions of the insurance company, the provider, or an advocate, and they can help you navigate that further. I think, patients often, healthcare expenditures for people are exponentially higher every year, right? More and more of someone's salary ends up going to healthcare. And it's the same for employers too. I mean, you have to feel bad for an employer cost too, as it keeps rising. We average 15 to 20% a year, and healthcare increases in our premiums. I think as a patient, another important aspect and kind of a tip for patients to use is to ask if there's a hardship exception, okay? And so most practices have a hardship request form that the patients can fill out. Once they complete it, they can then have that reviewed for either a reduction or a complete write-off of whatever balance that they may owe. And that's been proven very helpful for patients to at least ask that question. Just say, I just cannot afford this, right? I mean, you're talking about, I have a $10,000 or $20,000 deductible now, and I can't afford all of this, right? Because I have to see other healthcare providers as well. So being able to just ask that question up front, and do you give cash pay discounts? If I pay my balance in full, will you give me a discount? Those are the kind of questions that providers' offices, for the most part, are very open to because it helps them get some money in the door, right? For a service that, rightly so, they did provide the patient, and it gives the patient a break, okay, and helps them with their healthcare costs. You have to remember, too, when we look at healthcare expenditures and costs associated with insurance versus someone who doesn't have insurance, those insurance contracts are negotiated with providers before you as a patient ever walks in the door. So as a cash pay patient with no insurance, they may quote you $120, $150 for a new patient visit. An insurance carrier, on the other hand, may have negotiated a rate of $75 if you had that insurance and you walked in the door. Doesn't really seem fair, does it? As a cash pay patient, the provider doesn't have to bill. Okay, they have to do virtually nothing except accept your payment up front. They get paid up front, 100% of what they ask you. So I think it's fair for patients to also ask for that reduction and say, can you meet me halfway? If I pay in full, or maybe they're going for a procedure that isn't covered, or is considered, you shared your eye surgery with me, maybe it's considered experimental by some insurance companies, and they're not going to pay for it, right? That's the time to then negotiate with the provider's office, the clinic's office, that medical center, and say, look, I understand this might not be covered. I need to know how much it is, okay, which is why the No Surprise Act was instituted this year. But also, you can shop around, right? There's multiple diagnostic centers, there's multiple surgery centers, and ask for that reduced fee for patients. As a patient, the few items that you can certainly ask for is a hardship request form, okay, for a reduction in your bill. If you already have that bill, ask for a discount if they pay in full, as patients pay in full. And then you can also ask for a discount off of cash pay services that are not covered by your insurance company.